Hello everyone. It's a little time for Wednesday Wisdom. I wanted to touch base with you and let you know that we are working here in the office. All is going well. Patients have been quite good about calling as soon as they enter our parking lot, and we are directing them at a suitable time. I don't think anyone's had to wait over 5 minutes to enter the office and move into an exam room. It's been quite smooth and everything's going quite well. Today, though, I'd like to visit with you a little bit about what we're learning about vitamin D and this viral infection. And I'm glad to say that keeping our vitamin D levels appears to be a very positive thing as far as what we can expect to experience. It was noted that, of course, up in New York, we're seeing a great amount of discrepancy between African Americans affected by this virus, and it's thought, and perhaps could be, the fact that 80 to 90% of African Americans tend to be vitamin D deficient. And likewise, they saw this large group of homeless folks up in Boston who tested positive for the virus and absolutely no symptoms and no problems. And these people tend to be fairly poorly nourished. And the thinking there was that these people are outside and probably being exposed to the sun more and higher vitamin D levels. So there was a group in New Orleans that looked at a very small group of patients in the ICU and found that 100% of the patients in ICU under 75 that were being treated for COVID had low vitamin D levels. We also know that vitamin D insufficiency increases this prothrombotic effect in the body that can increase risks for some of the clotting coagulopathies that we're seeing as well. So I think that we can take some wisdom from this, and I think that we continue to take our vitamin D. Of course, we always recommend taking a little K2 with that, so that we make sure that calcium is entering our bones and teeth rather than in our organs and our blood vessels. But trying to achieve a vitamin D level, not just above 30, which our reference range is 30 to 100. We want our levels above 50. So would encourage you to stay with that program. If you don't know your vitamin D level, it's always good to have that checked and take supplements accordingly, somewhere probably between 2,000 and 10,000. It's very hard to be totally toxic on vitamin D, but it's good to keep levels under 100. So I would encourage you to consider that, and look forward to visiting with you in the future. We'll continue to send out words of wisdom on Wednesdays at this time. And if you have anything that you have questions about or anything that you would like to see further discussed, please let us know. Talk to you soon.